So guys, there's this video making rounds in social media talking about the need for men to have regular intercourse, like up to 21 times in a month, in order for them to reduce their chances of developing prostate enlargement. Now, some people were of the opinion, what about those of us who are not married, who doesn't want to soil our hands in the things of the world before getting married, or those of them who are celibates, who don't want to, engage in sexual intercourse? Does it mean that they are going to develop prostate? I'm here for you. I'm going to be giving you tips on how you can reduce your chances of developing prostate even without having sexual intercourse. Yes, research has found that there is a relationship between regular intercourse, regular ejaculation, and reduced risk of developing prostate. So, however, those of you who are not opportune or who are not married, to enjoy that regular ejaculation, I am here for you. I have your back. So please do watch this video till the end. So in case you are coming across my videos for the first time, this is Care Spot, a place where I talk everything related to health and healthcare. So if you haven't subscribed yet, make sure you click that plus icon or you click the subscribe button so you always get my content anytime I upload them. Now, before I start giving you tips on how you can reduce your chances of developing prostate, I want to tell you all you need to know about prostate. Prostate is more like a small gland that is part of male reproductive system. Now, your prostate contributes additional fluid to your semen, that is your ejaculate. Ejaculate is more like all those whitish fluid that you produce when you orgasm. Now, your prostate muscles also help push semen, all those fluid, into and through your urethra. No, women do not have prostate glands. Rather, they have what we call scanal glands. And people believe that these scanal glands are replacements for prostate glands. This is because this scanal gland is also located at the site of the urethra in female, and it's believed it produces more like a fluid that cleans the urethra. Again, researchers also believe that these scanal glands might also function in female ejaculates. See, your prostate gland is below the bladder and in front of your rectum. Your urethra runs in between the prostate gland, and it is believed to have the size of a walnut, like as small as that. One important thing I want you to note is that the prostate gland tends to get larger at age 40. It is normal. It's just normal that it gets from the size of that walnut, it grows larger to the size of a lemon. When it's a problem is that when it grows way more bigger, that it becomes a problem. That is when we call it prostate enlargement. There are common conditions which can affect your prostate. One is prostate cancer, which is the second most commonest type of cancer. Secondly is inflammation, which is medically known as prostatitis. Now, this condition could be as a result of untreated infection around the pelvic region. Now, it might be as a result of bacterial infection, untreated STI, and the rest of them. Lastly is benign prostate hyperplasia, which is commonly known as prostate enlargement, which all men at 50 age and above is likely to develop in their old age. The commonest warning signs of prostate problem include: one, you see, whenever you are having pains in your penis or your testes or your perineum is more like those area in between your testes and your anus. That area is your perineum. The second one is when you have this frequent urgency to pee, like you are not getting the sign, all of a sudden you want to pee on yourself, and when you did not answer that call, you end up peeing on yourself. Is a warning sign that you might be developing prostate problem. See, others include pain, feeling pain when urinating. Normally, urination is not supposed to be painful. Whenever you are feeling difficulty to start the pee, like when you want to start up urinating, you are feeling this difficulty. Another one is frequent need to get up at night to pee. Other ones is erectile dysfunction. Ana akpọ dike na-ekwe azoku. Eme ya ihe niile chilie ya elu utuo ya ọ na-ekwe aza. Is a warning sign that you might be developing prostate enlargement. Others could be either blood in your urine. When you are urinating, you see blood, or in your ejaculate. When you release that sperm and you see blood in it, is a warning sign that you might be developing prostate problem. Lastly is pain in your back, lower back, your chest. Whenever you are doing any kind of activity, is a sign that you might be developing prostate enlargement. So the earlier, the better. The commonest test that you can do to check your prostate health is one, what we call digital rectal examination. In that examination, your healthcare provider or someone at home can insert a glove hand into your anus. There in that anus, because from the rectum you can really feel the prostate gland. When he feel, or the person feel the prostate gland, if it is bumpy or hard, it's an indication that you might be developing prostate cancer. The second one is prostate specific antigen blood test. Now, remember your prostate produces a protein, and elevated PSA, which is prostate specific antigen test, indicates that there is an abnormality in the prostate. That means it's either maybe there is a cancer or there is an enlargement in that prostate for it to be producing that too much of that particular protein. The last one is what we call biopsy. In that biopsy, your doctor takes a sample of your prostate gland, examine it under the microscope for any abnormality. I have taken all my time to explain all you need to know about your prostate. I think this video is quite long now, and I will be ending it here. I think I'll be making a part 2 for this video. So if you have watched till this point and you find this video really informative, please do the needful by clicking the like button and share the video. Why not? Why can't you share this video? Okay, bye. See you on the second one.